The ones that are outside, they cause abdominal pain, abdominal discomfort, but they don't really lead to the prolonged period of spotting or infertility. Yeah, so the ones that are outside usually affect outside the organs surrounding the female reproductive system. Like this one, it can put pressure on the digestive system. Yeah, so that will hinder the function of the digestive system, leading to conditions such as bloating, sometimes constipation, sometimes diarrhea. So it affects the functional process of the digestive system. Others can even affect the pelvic, yeah, leading to extreme pain in the pelvic. Yeah, the ones that are outside. So the next condition is endometriosis. So we talked about the endometrium, which is the lining of the womb, of the uterus. Yeah, and the endometrium is the tissue that thickens, and if fertilization does not occur, it shades, leading to the menstrual cycle, menstrual periods. So endometriosis, anything that has a cis at the end, it usually means inflammation, any condition. So it is the inflammation of the endometrium. So it is an often painful disorder in which tissue similar to that normally lies inside the uterus, the endometrium, grows outside the uterus. Yeah. So go back. Yeah. So we move this diagram. So this is the endometrium. This is now the endometrial tissue. So you find that people who have endometriosis, the tissues can grow outside the fallopian tube, outside the womb. They can grow anywhere, not just in the reproductive system. They can even grow in the intestines, outside the intestinal tissue. So endometriosis can cause pain during menstrual periods and can cause fertility problems. So for endometriosis, during menstruation, endometrium is the one that shades, right? So when the time for menstrual cycle or menstrual periods comes, you find that even the endometrial tissues that have grown outside the reproductive system of the lady try to shade. So when it tries to shade, it's in form of blood and it's shading. When it tries to shade, there's nowhere that blood can move. So sometimes the blood travels just within the abdominal cavity, leading to extreme pain. Yeah, during periods, during intercourse, during defecation when you go to the toilet for long haul. So endometriosis can grow anywhere, even in the intestine, and for severe cases, it can even go up to the respiratory system, yeah, leading to collapsing of the lungs.
How does that blood come out eventually?
Most of the times, it's usually taken out by surgery in the hospital, because now it is held within the abdominal cavity. Yeah, so there's no way for it to go. There's nowhere for it to go. So most of people who have endometriosis, in severe cases, they usually go for surgery for removal of the excess shading of the tissue. Then another condition is infertility in women. So infertility means not being able to get pregnant after 1 year of trying. Yeah, so if you try for 1 month unprotected intercourse, that is not infertility. But after 12 months of trying with unprotected intercourse, now that is known as infertility. So causes of infertility can include the conditions that I've mentioned above, like endometriosis can lead to infertility, fibroids can lead to infertility as well. So women who can get pregnant but are unable to stay pregnant can also be known as infertile women. Yeah? And then there's also 2 types of infertility. There's primary infertility, where you find a woman has never had a child. Yeah? So that is primary infertility, and when she tries, she cannot get pregnant. Then the secondary infertility is where a woman has had a child, but when she's trying to get another child, yeah, she can't. So that is secondary infertility. Other causes of infertility include hormonal imbalance, the hormones we mentioned above, lifestyle, other conditions, maybe blockage of the fallopian tube or blockage in the womb. So when you look at WHO demographic, World Health Organization studies from 2004 have shown that in the sub-Saharan Africa, more than 30% of women aged 25 to 49 suffer from secondary infertility. So that is, they have maybe a first child, but when they try to get another kid, they are unable to. So that is secondary infertility. Then the last, this is not really a condition, it's a natural process of the body. It's called menopause. It is a natural biological process, marks the end of reproductive years, and happens within age 45 to 55. But due to changes in lifestyle, recently, some women at the age of 35 have become now menopause. So it's starting to happening at an earlier age in recent years. So what are the symptoms of menopause? There's fatigue, night sweat, hot flashes, nausea, mood and we don't explain that. So what are the stages of menopause? There's premenopause, where there's no menopausal symptoms at all, but the lady still has periods. But for premenopause, they can experience things like fatigue, night sweat, or hot flashes. Then there's the perimenopause. So this means around when you're now getting to menopause. Symptoms of hormonal changes, and the woman can still become pregnant, and usually lasts about 4 years. So this is where now the lady can start experiencing the hot flashes, nausea. Then we have the menopause periods now. So no period for 12 consecutive months. So you do not have periods for 12 months consecutively. Now you're at the menopausal stage. Ovaries stop producing eggs, and average age of menopause is 51. Then there's the post-menopause, over 1 year since the last period, and will remain in this state for the rest of their lives. So during this stage, the hormone known as estrogen, the levels of estrogen usually go down. And when estrogen levels go down, that is what leads to these symptoms, including weak bones. So women at the menopausal stage are very susceptible to osteoporosis, because low estrogen levels lead to the body now starts using calcium from the bones for other body functions, because actually estrogen helps in maintaining the levels of calcium in the bones. So when estrogen levels go down, calcium levels in the bones also go down, so the bone mineral density goes down. So this can lead to weak bones or osteoporosis. That is why menopausal women are usually advised to take calcium supplements or increase calcium intake in their diet. Another symptom is low libido because of the hormonal imbalance or low level of estrogen.
Excuse me, sorry. But we have had cases of ladies who are given birth at 60. How do you explain that?
So that is just what can I say?
Deception.
Yeah, but it's true. There are ladies who have given birth at 60. There are some people, but very few women get to menopause at maybe even 70 or 60. Very few. But right now, actually, in recent years, menopause has started to begin for women at the age of 25. Some women now. But those cases are not so many. They're 60 years of age and someone is pregnant. It's not so many.
Now, should we understand that estrogen facilitates absorption of calcium from the gut?
Yes.
Okay.
And it also helps in maintaining the amount of calcium released to the blood from the bones. Next. So let's look at the products in the 𝙒𝙊𝙈 that can help in maintaining a healthy reproductive system and even managing the conditions that we talked about. The first one is refined youth essence. Contains PSP, polysaccharide, and polysaccharide peptide, which can deter abnormal cell growth. So for youth now, it is really good for people with fibroids and endometriosis. Because fibroids are abnormal cells that grow out of nowhere. So they can slow down or prevent completely the growth of the abnormal cells. And for endometriosis, it can prevent the growth of tissue in a place where it should not be growing. So because endometriosis does not grow, endometriosis grows outside the reproductive system of the lady. Also regulates hormonal balance. So the hormones estrogen and progesterone. 𝙒𝙀𝙇 can be used to regulate the hormonal imbalance in ladies with hormonal imbalance, because hormonal imbalance can also lead to those conditions: endometriosis, fibroids, infertility. Yeah. Then it reduces pain and inflammation. So conditions such as fibroids and endometriosis are usually one of the symptoms is inflammation. Yeah, they inflame the body. For example, say endometriosis, anything that ends with a cis is inflammation. So 𝙒𝙀𝙇 is really good for people with endometriosis because it prevents inflammation. Then enhances skin elasticity. So the polysaccharide peptide can help in enhancing skin elasticity. So for ladies, when estrogen levels go down, it leads to reduced skin elasticity, dry skin, sometimes even breakouts because of hormonal imbalance. So refined 𝙒𝙀𝙇 helps in maintaining the elasticity of the skin by helping in production of more collagen, which maintains skin elasticity. Then next.
Before we go to me, I just want to say something small. While we were in Mombasa last week, a talk came up amongst the senior ladies we had, and they said 𝙒𝙀𝙇 is their product. 𝙒𝙀𝙇, for those who are in menopausal stages, they say this is the product that really helps them balance out. I had something which I did not know very well. They say use better than even anything else. That use their product. So I just wanted to add that. It was a testimony.
Yeah. So use is that especially in balancing hormone and preventing abnormal cell growth. So next supplement is 𝙒𝙒𝙈. 𝙒𝙒𝙈 is made from grapeseed extract. The grapeseed extract contain very high levels of antioxidant properties. So contains antioxidants that fight free radicals in the body. So the antioxidants also help in promoting skin elasticity, those help in production of collagen, and fights inflammation. The conditions we talked about include inflammation, endometriosis, fibroids, they include inflammation. Then enhance healthy skin and delicate tissues in the body. So for delicate tissues, for a condition such as endometriosis, it grows on other delicate tissues. So when you give someone who has endometriosis 𝙒𝙒𝙈, it will help in, for example, when that person is healing, it will help in creating new tissues, that promote faster healing for people with endometriosis. So 𝙒𝙒𝙈 is good for people with endometriosis and also fibroids. It also helps in balancing hormones as well. Don't forget that. So the next product is probiotic. So probiotic is known as a digestive product, but probiotics have a very complex functions in the body apart from helping in digestion. So they modulate the natural bacteria in the vaginal canal. So the vagina has an acidic environment. So the vagina, a healthy vagina has a healthy amount of lactic acid. So when the levels of lactic acid are good in the vaginal environment, we'll have a healthy vagina, no odor, no itching, and good balanced levels of probiotics, so the good bacteria. So probiotic modulates the natural bacteria in the vaginal canal and prevents bacterial infections. So it is ideal for pregnant women, so to use probiotics. This is because if a lady does not have a well-balanced environment in the vagina, during childbirth, that environment can affect the baby. It affects, the first thing that it affects is the skin of the baby, the eyes, that is why some children can be born blind, and their ears. Sometimes, when the baby is born, they can even open their mouth, so some substances may go even in their body. So anything, the environment of the vagina can really affect your child, even the immunity of the child. Because now if you have a good amount of probiotics in the vagina, inside the womb, it is a sterile environment inside the womb. There are no probiotics. So when the baby is inside the womb, that kid has no probiotics in their system. But when the baby is passing through the vagina, and you have a healthy environment in the vagina, that is now the first contact. That is the time the baby has the first contact to bacteria. So you want that baby to have the first contact to bacteria, to the good bacteria, not the bad ones. Yeah. So a healthy vaginal environment can enhance a baby's immune system. Yeah. So it has shown to reduce rates of pregnancy complications associated to bacterial vaginosis. Yeah. It also helps in treating UTIs, yeah, uterine infections. Yeah.
A question. Probio is oral administration.
Yes.
How does it manage the vaginal environment?
So all probiotics, there's a way that the body delivers probiotics today. Yeah, because I have not seen any probiotic supplement that is not oral. Yeah. So the body knows how to deliver the probiotics to that environment, because the vagina actually is an internal organ. It's not external. Yeah. It is internal. Next, we have 𝙒𝙀𝙀𝙆. So 𝙒𝙀𝙀𝙆 reinforces the vagina's resistance to infection. Yeah, it eliminates abnormal vaginal discharge, unpleasant odor and itchiness, and effectively prevents infection from harmful bacteria and keeps the vaginal area clean and comfortable. So for 𝙒𝙀𝙀𝙆, when you use 𝙒𝙀𝙀𝙆, it is really good for maintaining a good vaginal pH. Does not affect the probiotics in the vaginal environment. So it is very clean, it keeps your vagina clean, no odor, comfortable, prevents itching and prevents infection. Increases the vaginal resistance to infection. So it's like it increases the immune strength of the vaginal environment. So next, that's 𝙒𝙀𝙀𝙆. So that's for oral. No, that is for adultery.